So to begin, our first presenter is Dr. Mark Svoboda with the National Drought Mitigation Center. He's the director of the National Drought Mitigation Center, and Mark and I have worked for many years together, so he will kick off this session for us this morning.
Thank you very much, Mike. Good morning. Welcome to the session. We've got, I think, a really good lineup with the diversity of speakers from around the world. I think, to me, the fun part about putting together the panel is I've had the opportunity to work with each of them in some form or capacity. So you're going to hear a lot about that and partnerships and collaborations and such. So I'll focus quite a bit on that in my talk here today. So I want to talk about the overarching aspect of now what. We have focused primarily in a lot of places on drought monitoring, early warning. We'll hear a lot of talk, I'm sure. I'll speak to it, I'm sure Rachael will too, but the three pillars and how do we tie these together for a comprehensive drought risk management program. So the Drought Mitigation Center, for those of you who are not familiar with us, is what I would categorize as a boundary organization. So one of our main chores is to translate science for the public, for policymakers, for decision makers, to the media, etc. So everything we do is oriented towards making things understandable and usable. So not just usable, but not just useful, but usable. So our staff, with that goal in mind, and actually Dr. Hayes didn't mention this prior, he preceded me as the director for 10 years. We've been around, the Drought Center's been around since 1995. Mike and I joined 1 month apart back then in day one with the founding director at that time, Dr. Wilhite. So, but where I'm going with that is that half of our staff are focused on social science. So we really put a lot of emphasis on the now what type of stuff. So that's what I'm going to focus on here today. And we do that through a variety of services, oriented sort of approach, very stakeholder oriented, getting out there on the ground with people to develop trust, and then carrying that through so they have a voice in the process all the way from the very beginning to the end product. And then we carry on those relationships well after the project goes away, which is the very rewarding part to me. So we're very applied in nature is the bottom line. So you can see the green circles, well, to back up, the blue circles there, we talked about the three pillars, right? So we have drought early warning, which is the monitoring. Personally, we don't do the forecasting per se at the Drought Center. And then we have vulnerability and risk assessment, which the social team focuses on quite a bit. And then the policy and planning, of course, is the now what. On the far right, on the green, this is the different areas that we work in. Again, I mentioned those up front, but the bottom line is we want to make things usable for folks to use. So here I want to acknowledge a lot of our partners, many of whom are in the room on this panel, but also sitting in the audience that we've established over the years. And this is certainly not all of them, but these are some that are, again, focused on the topic of today. And so I just want to acknowledge all the friends in the room. Because each of these projects, you'll see this is where we've been, our footprint spatially over the last few years. The countries in dark blue are those we've worked with, say over the last 5 years, 3 to 5 years, on a variety of projects. So these aren't just going to a meeting somewhere. These are typically more project oriented. And that falls within the group of the United Nations family, where we're working with a lot of those different groups. But primarily some are here this week as well. We've heard from like FAO, the Food and Agriculture Organization, do a lot of work with the World Meteorological Organization, and the Convention to Combat Desertification group as well. So a smattering of those groups. And then you heard the speaker this morning, Jennifer, from the World Bank. We're doing projects with them. And in fact, hosting a group from, she mentioned the Botswana project in Eswatini, and we'll be hosting a group of their technical scientists here to start to go down this road of developing all three pillars. So very excited to kick off that project here in June. So one of the first bell cow products that we put on the map that really helped put the Drought Center out there in front of people was the U.S. Drought Monitor. This was developed back in the late 1990s, and it's a three-way collaborative project that doesn't have a line item funding budget. We've done this out of hide ever since we've started. We've just kind of pieced together what we can here and there, but it's with the United States Department of Agriculture and NOAA, which houses both the Weather Service that most of you are familiar with, but the Climate Prediction Center and what was used to be called the National Climatic Data Center, which is now the National Centers for Environmental Information. The reason I put this screenshot up here is just to show you we've recently expanded it. On the bottom left, you'll see an inset map. If you go to the website, you'll see the large-scale map. If you click on that, we just launched operation of the United States affiliated Pacific possessions, islands, I should say, and that's just kicked off, and we'll also be doing the U.S. Virgin Islands here this summer to expand the breadth of where the drought monitor is covering. What makes that product unique, and I think got us a lot of buy-in and trust, was, again, I talked about engaging folks and users from the very beginning at the ground level. So this is a distribution of over 400 people that contribute to the drought monitor each week. Not all 400 every week, depending on where drought is, but during active weeks, it can be pretty hectic to get that information into the process. Now, of course, the map I showed you, we only have less than 4% of the United States in drought right now. So this is a record low since we started making the drought monitor map, but certainly historically pretty darn low when you compare it to periods of active drought, and even actually compared to even periods of non-drought. That's a very low percentage given the size of the country. We typically average around 10 to 14, 15% of aerial coverage in drought. So who uses this? So I talked about users, top left there. Again, it all scales: local, tribal, state, county, municipality, federal and state agencies, and NGOs as well. And it's gotten a lot of play when it started getting shown on the Weather Channel back in the day. That really put us on the map. But more recently, what's made it work has been we were building this sort of science, as I call it, science before policy. So it wasn't mandated from the top down saying, build this drought early warning product for us for policy. We built it. They kind of watched or lurked, if you will, before it actually got implemented into policy. And now you can see there's a whole bunch of groups now at the state level. Several states use it as a trigger. But most importantly, what put us on the map here was the 2008 Farm Bill, which used it to trigger livestock forage disaster program. To date, that's $7 billion of assistance to livestock farmers that didn't have the crop insurance sort of net at their disposal. So we were providing, I think, a very usable service to the livestock community. Worked with the cattlemen's associations and others around the country, listening to their needs, and developed this independently before they used it. So again, we have to keep it very unbiased and let the science drive our decision making. But you can see a lot of others here that I don't have time to go into. So I talked about the 3 pillars. This is another thing that was born out of Dr. Wilhite's initial vision for the Drought Center, was to focus on the 3 pillars: drought early warning, risk vulnerability assessment, and policy and planning. And so we've been coordinating and working with the Integrated Drought Management Program. That's a partnership between the World Meteorological Organization and the Global Water Partnership in Stockholm. So a lot of the services that we provide, not just on the early warning, I wanted to show 2 examples. One, the drought monitor, and then on the planning side, you can see here it's a continuum from the very local or even individual scale. I'd say in the last 10 years or 5 years, a lot of our requests are coming at the sub-state level. So not even at the state level, but at the individual rancher, producer level, and certainly at basins and communities. With all the climate change adaptation sort of planning efforts, water planning, et cetera. They've had a need to include drought in their mission, if you will. So we're providing a lot of resources. Droughts all start local because that's where the impacts hit the road. So you can see here when, if you go back to 1982, only 3 states had drought plans. Now on this map, we show 45 with drought. So you think, oh, our work's almost done. 45 out of 50 ain't bad, right? But notice that we only have 13 in dark green. These are what we call mitigation plans that integrate really what we'd say all 3 pillars, not just 1 or 2. So that's our focus, is on a lot of work to do to get that whole map dark green is what we're shooting for. To kind of wrap up here, I just want to show a collage of a lot of different partners that some are in the room here. We've heard a little bit. We'll hear more from Eduardo on the Brazil, Northeastern Brazil drought monitor that we had a part in playing with World Bank as well. And most recently, you're going to hear from Rachael, the whole center panel here on the Middle East, North Africa. It's been a great project. The first 3 years, phase 1, we're phasing into phase 2. You'll hear a lot more from her on that. And then you heard a little bit about our work in Africa from Dr. Sagai Tedessa yesterday. Here's just a smattering of where we've been at here in Africa lately. A lot of different groups on the left. You'll see a lot of the partners that are here this week. So I can't overemphasize that enough. It is really, it's a big sandbox. There's a lot of, drought is so cross-cutting. There's plenty of work to do, and we welcome partnerships in helping us do just that. This is an example of the drought early warning system we've been developing with Rachael's team prior at ICPA and now at the International Water Management Institute in Sri Lanka, and is to develop drought early warning global hotspot maps and then work with them to take that information into policy and planning, which is what phase 2 is starting to do. There's our partners there at the bottom. And this is just an example. We were in Lebanon a couple weeks ago to wrap up a workshop there, phase 1, as we go into phase 2, and developing their drought early warning system. And now we're going to work into policy and planning. So just to wrap up, I think, again, we're very applied in nature. We're trying to develop information and tools, decision support that's usable by the locals. They take ownership of it and run with it themselves, which I think is critical. We don't do it for them. So we want to work with them and give them the capacity and training and work with them after the project's over as well to sustain that as they go forward. So I've touched on all these. I won't reiterate them all except to say thanks again for coming. I think you're going to hear a lot of good examples of the folks I've had the privilege to work with on this panel. Thank you.
Dr. Martin. He is the president of FUNCEME in Brazil, in Fortaleza, Ceará state. So he will be our next speaker.
Okay. Thank you, Mike. Thank you, Mark, for inviting me here. It's a pleasure to share our experience together with National Drought Mitigation Center. They really play a key role for us to move the agenda of drought preparedness in Brazil. And also, I'd like to recognize the work that World Bank did and supporting all the activities that you carried on in northeast of Brazil. So I'll give a little bit of context. Maybe folks here don't know where Ceará is, where Northeast is. This is Brazil, and this dashed area is the polygon of droughts. It's an area that's really cope with a lot of droughts through time. And just to give an idea, this is SPI figured from 1 to 36 months, how it is evolving through time. As you can see, the last drought that we experienced was very long drought. And although this is an average for the state, we see that there are some areas that really cope with very, very severe drought. As you look at the individual years, we don't see very severe years when compared to the historical record. The problem was the sequence of those years. So when you look, for example, this year 2019, as I would like to point out, we have a very strong gradient north-south, where the areas in hot colors are the ones that really are coping with droughts still. And these are the areas that we have the biggest dams. So we are still having 30 cities out of 184 that are in risk of water scarcity. So this is why in this dashed area we have very low storage levels, below 10%, and some of these dams are completely empty. So just to give an idea, we built the network of the drought monitor on the existing network, the climate network. It was very strong in Brazil. So we started increasing the connections with the agriculture sector, the water sector, and also trying to reach out the the stakeholders itself. So now we are working with the Agriculture Secretariat to have strong connection with farmers on the field, and also not only provide information to them, but then getting the information to us as well. What are the impacts? We are a network of around 47,000 farmers, small farmers, and the triple of that indirectly through the agriculture extensionists. So in the right, you see the drought monitor as evolving through time. It's a very recent project, I would say 5 years in July. We start with 9 states in the region with support intensely of the National Drought Mitigation Center. And now we are expanded to the other parts of the country. So we now have Minas Gerais and Espírito Santo, and we're starting talks with Goiás as well. So the idea is to have the whole country all together, and I'm looking forward to continue the collaboration with the center, the National Drought Mitigation Center, on that. So now we're trying to establish field connections with people on the ground that really could benefit from this this project. Okay, so we launched, as Mark told about the drought monitor here in US. We launched the monitor. Don't worry too much from the start on the users, and just trying to convey the message, the importance to get this information in the open and see if people start using somehow. And we start getting some news on that. We have the National Civil Defense Program, water truck tanks, to guarantee water for a scattered population in Brazil. So they start using the monitor, and if the municipality has any percentage of area in drought severity level D1 or above, so they don't have to do anything. They are already included in the program. So this is something that we really enjoy to see on the ground, people using the information to make decisions. And at the same time, we are starting talks with the Ministry of Agriculture for the Harvest Insurance Public Program. So if the general idea will be that if the municipality has any percentage in the category D1 or above, we are discussing that. They don't need to provide any additional information. So, but we still is in the initial talks, but I think there's some way forward for that. So we're starting coming up with ways to provide information for the sectors. First idea was to have the monitor for specific basins in the state and see how the water sector react to that. And it was nice because gave us an alert of the level of drought that this basin is sustaining through time. So we have some products that they can access directly through the site. We generated this automatically to the water agency in Ceará, and the idea is to expand to the other states of the country. But it's not that easy, and the remote sensing folks could help us a lot. We have a lot of small reservoirs that we don't have any information about. They are private, built by farmers, and so. Just to give an idea, Ceará is 1/3 smaller than Nebraska is also. And we have more than 30,000 small reservoirs below with water area, surface area, greater than half hectare. So this have a huge impact on the inflows for the main reservoirs of the state when we are on the drought conditions. And this is something that we need to make people aware of. So trying to understand how the meteorological drought propagates onto the hydrological drought has a challenge here that we have trying to address. So also we have to work at a scale of the sector, of the interests of the sector. So, for example, if you are looking at a hydro system, you have to come up with levels that are related to levels of risk that you are subject to drought or not. the same thing for the urban supply system. So we did come up with the help of the World Bank and now with the support of the National Water Agency that is running the show now, and come up with some case of studies on those typologies of users. So hydro systems and urban supply systems and rain-fed agriculture systems and so. So we have some cases of studies on that, try to address how would be the nature of the decisions and how they could incorporate the use of the monitor, or if they need to come up with a specific monitoring system that is related to the monitor itself. So for a reservoir, a hydro system scale, we would have different levels of these reservoirs associated with different risks and with different users that would be have water allocated if the level of the reservoir falls in the range that we are seeing different colors in the screen. So this was one of the ideas. And the other was more complex one. It's a hydro system. So we come up with urban supply system. They're responsible for Recife water supply. So we did have different tools to derive operational rules for the system and associate to the levels of the reservoirs and the risks of being subject to a drought of D1, D2, D3, and so on. And this was an idea, and by the end, we start to derive, depend on the stage, the drought triggers, and what would be the response targets to have in terms of reduction of consumption for the urban area. Well, the challenge, what's next, now what? Well, it's sector specific than what, in my view. We have to work with the sector itself and really try to understand the kind of the decisions that they have to make and try to map that as good as we can. If the focus is a managed system, the plan is also specific to that system. This is why it's so challenging for us because every system is a new pilot, is a new study for us to come up with really coherent contingency plan for that. So starting the process, choose the right cases and players to demonstrate the value of the plans. This is what we are trying to accomplish now when bringing new states to the monitor, trying to demonstrate to them how important it is to have this kind of information. And build the strategies with those already involved. This is really important, and try to identify the right people to get involved. There's a lot of problems in getting institutions involved. People have to be empowered and feel that the process, they are part of the process, and they have some ownership on that too. Well, thank you very much.
Speaker this morning is Dr. Rachael McDonnell, and Rachael is a principal researcher for the International Water Management Institute, IMI, based in Rome. So, Dr. McDonnell.
Thank you, Mike, and it's a great pleasure to be here, as ever, coming to Nebraska. What I wanted to share with you today is the work that we have been doing in the Middle East, North Africa. If you think about it, well, North Africa's like this, and Jordan, Lebanon, those countries, there's quite a bit of similarity, and it's a relatively arid area already. But what we're finding in our project is it is very different. Drought in each of these countries is very different. So what I want to do is I'm starting with the so what's next. And this is really looking at the second phase of a USA project that we've been doing. And all of this, we started working with Nebraska probably 5 years ago. And we could see that droughts are going to be an increasingly challenging issue in the Middle East, North Africa. You've only got to look at the situation in Syria and many of these areas here. But where do you start? You can download your idea, your 10 steps from the World Meteorological Organization and GWP, but that doesn't really tell you how to start. So we were delighted to hijack Nebraska to join us on our journey. And so it's very much from Nebraska to the MENA. So Mark's talked about the 3 pillars. So our first step of it all was setting up drought monitoring, and we've just been hearing from Dr. Eduardo about this. So if you're going to set up operational drought monitoring, this means it's got to be able to work when the internet is a little bit difficult, when the budgets are being cut, and it's also got to be about accessing data that's free. So in designing that, we could make a very complicated drought monitor, but we have made a relatively simple one, building on the experiences of the North African drought monitor. And so we have developed a drought monitor for each of those 4 countries, Jordan, Lebanon, Tunisia, and Morocco. This was undertaken at the International Center of Biosaline Agriculture, my former organization, working with Nebraska, and at the regional level. And here we brought together drought maps, but what we then did was, the bringing together the data technology and pressing the button is an easy bit. We now have to validate it. So what we've been doing is we've been working with in-country partners, and we're going to say, we can generate the maps for 2014, but does it actually reflect how you were experiencing drought in that year? Because drought is a very local, it's a very subjective, it's a very unique experience. So we've had to look, for example, in Morocco, there's a lot of snow, and in Lebanon. So if the drought is during that winter period, and the snow doesn't fall, it means that spring and summer stream flows are really messed up. So we have, and not only have we had the validation take place in the country, we're also building from Nebraska's experience, the US Drought Monitor, and setting up evaluators. So as we generate that data, we need people in different parts of the countries to check, is it okay? Is this drought map okay? Because what we have to do is we then have to be able to make decisions based on that drought map. This might be involving funding, it might be involving turning water off. So we have to be able to trust that drought map. So this is the stage we're at. The other thing that we learned from Nebraska is that it has to be multiple ministries, interdisciplinary, everybody coming together. So that means sharing the funding, sharing access to the technology, sharing access to when Nebraska comes to town, which is always a big pull. So this is how we've done. So in each of the countries, the generating group tend to be young engineers from meteorology, agriculture, water, economics, and environment, and they generate the map, which means that their stakeholders are happy with it. The second pillar is looking at vulnerability and impact assessment. We need to know who is impacted and why are they impacted. Because just because you have a drought does not mean to say that you are going to be as negatively impacted as that. So we need to look at which sectors, and because of our, in each of these countries, rain-fed agriculture is very important. We know that agriculture and so food security is a major impact. But what we also know that a drought in Jordan and a drought in Lebanon can be equally severe, but the impact in Lebanon is much less because there's 50% irrigation. But the problem is, it looks as though it's less severe because the crops keep growing and the vegetables make it to the market and they export to Europe, so it doesn't look that bad. Well, what's happened is there's been 50 or 100 more illegal wells put in. So groundwater's gone down, so the ability to cope going forward is challenged. And so we've been looking at and finding that drought is very different in those countries, and it's political. One of the big challenges in all those countries, all 4 countries, have received a lot of refugees. For example, in Lebanon, the population was 4 million, it's now 6 million. So we have the stresses of a very strong input and water insecurity, and then on top of that came the worst drought in 60 years. So what have been those challenges? How are we going to do it? We need to look at that. And under that, we need to look at the vulnerabilities. Why is it? Is it access to credit for the irrigation? Is it land ownership? Is it because the young have all gone to the cities to earn the money there, so the elder are struggling with it? We're really trying to understand that. So that was Pillar 1 and Pillar 2 undertaken in Phase 1 of the project. So we've now started MENA Drought Project, and this really is the what's next. Because now we have to do with that horrible politics and working together and working on diplomacy to be able to look at how do we trigger actions. So Pillar 1 is one of the things that came from the farmers and the various organizations is, we don't need your drought monitor, we already know we're in a drought. You know, we don't need that. But what they're wanting is they want seasonal forecasting. So on my way back on Friday, I'm back with NASA, and USAID has funded a sister project which is helping to produce early seasonal forecasting. What's happening in the next 30 to 100 days? This is very difficult. We can't do it at the moment, but this is what the water manager wants and the farmer wants, the Ministry of Agriculture definitely want. Because what happened, for example, in Lebanon, in the Bekaa Valley, which is the center for agricultural production in the 2014, is the farmers tilled their land and then the municipality turned the water off. So they wasted their seeds, they wasted their fertilizer, and there was no coordination in this. So it's that sort of work. In Pillar 2, this is where we need to bring the economists in, and we also need to bring those that can understand the differences in social costs, exactly what Jennifer Sarah said this morning. So if we're going to go to the Ministry of Economy and just say, we need this investment in whatever infrastructure, or we need information, or we need new institutions, we have to be able to prove what is the economic cost of the last droughts. And in all those countries, we don't know that. We can begin to see that food prices went up, and it costs the government a lot more in subsidies, subsidizing food, or in importing wheat, whatever it might be. We don't know what it is. But if we're going to put forward a project or some sort of planning, we need to be able to put in front of that Minister of Economy, this is how much we can save if we bring in proactive drought management. And in terms of the social costs, we have the difference in gender, age, rural, urban. The way droughts are experienced is very different. For example, if you're living in an urban area during a drought, the water isn't running in your taps, so you have to buy it from the tanker. So you're often paying 10 times more for your water than in a non-drought year. And then the Pillar 3 is the very difficult one that Mark talked about. This is mitigation, preparedness, and response. In many of the countries, for example, Lebanon, there is no official declaration of drought. We don't know. We can't say there is a drought, therefore we need to trigger these actions. So this is part of the work we're dealing with. We're looking at water and technology packages. So my colleague here, Petra, is going to be helping us design resilience building. How can we bring in species that are more resilient? How can we bring in water technologies that are going to save water, so then during those droughts we can continue that? We want to look at institutional arrangements. Trying to get the Ministry of Agriculture and the Ministry of Environment and the Ministry of Water together is difficult, but to then agree when the next drought comes, you will do this, you will do this, and you will do this, and have the finance and the budget and the resources to go with it, needs endorsement from Prime Minister's offices or ones like that. So this is what we're working on a lot at the moment. And what we're also trying to look at is preparing plans now in a very calm, non-political way, because what happens when the drought comes, the newspapers are involved, there's lots of finger pointing. It becomes a highly politicized session, and so we don't have that calm rationality. So one of the things we're looking at is, can we use water accounting? Because if we can say where the water is going to now and who gets it and what type of water from those many different sources, we can then agree when the next drought comes where we can turn that water off from. So we can see that we are moving on to the what's next. What Nebraska is always constantly telling us is you have to take it slowly, you have to build the very strong foundations, because we need to make sure that at the end of these next 3 years, in those countries, there are policies and plans in action that will then be fit for purpose and used when the next drought comes. Thank you very much for your attention and for inviting me here.
Thank you, Dr. McDonnell. So our fourth speaker today comes from India, from Delhi. Dr. Ravinder Kaur is the principal scientist at the Indian Agricultural Research Institute, and I've had the pleasure of working with Dr. Kaur for many years. Welcome, Dr. Kaur.
I'd like to extend my warm greetings to all of you and my appreciation to the NDMC and the University of Nebraska-Lincoln for giving me this opportunity for being a part of this conference and to share some of our success stories on the Pan-India Composite Drought Monitoring, which is basically a US and India collaborative effort. Well, as you can see on the slide, This particular initiative was taken up under a USIF-funded program on improving water management, agriculture production, and food security in drought-prone areas in the year 2016, with Professor Dr. Christopher Neal as the principal investigator from the US side, and myself as the principal investigator from the Indian side. But that doesn't mean that the work has been done only with these two people. I haven't put the name. There's a long list of team members, both the scientists and the students, who are responsible for this success story to build up in such a short span of time. So we have folks from the NDMC Center, Dr. Mark Svoboda and Dr. Hayes and their team, and also a team of scientists from the Remote Sensing Center of the University of Nebraska, Lincoln. And we have folks from Water Technology Center from the Indian Agriculture Research Institute, and also from the Division of Agriculture Physics. Well, before I come to our success story, I think it's very important for all of us to understand what is the process of drought declaration in India. I'll not be very elaborate because I've been allocated only 10 minutes. So broadly, if you look at this slide, you will realize that drought declaration in India, it doesn't follow any unified or standard criteria. If you go from north to south and east to west, there are different criteria which are used to declare drought, which is a state subject because water is a state subject in India. Basically, the declaration of the drought from state to state depends upon the area unsown, the rainfall deficiency, and the crop yield deviations. So there are certain states which only make use of the area unsown and the rainfall deficiency, and there are other states which make use of area unsown, rainfall deficiency, as well as the crop yield deviations to declare the drought. So it's not a common standard procedure of drought declaration. And once the drought is declared, then the memorandum of scarcity is passed on to the center. The states are encouraged to use their state disaster relief fund to mitigate the drought. But if the drought is of a vast extent and the states do not have the enough funding to cope up the situation, then they send a memorandum to the states, to the center, and then the center sends the team, the verification team on ground, which verifies whether it is a real drought or a fake drought. And then based upon what is the extent of the drought, the team finds out and then submits the report. And then based upon that report and the verification process, then the center releases the fund. So it used to be previously a very long, drawn process. So with a large lag time for the response to take place. And as I will proceed, you will see that what actually was happening on the ground, whether it was a fake drought declaration or was it a real drought declaration and things like that. So they will become clear. Now, it was only after 2016 that actually the standard drought monitoring protocol, the need for that started in the year 2009. So government started feeling we should have a standard procedure for drought declaration. So certain standard protocols were drawn, but they were taken very casually by the states because these were not mandated to happen on ground. Then in 2016, a drought manual was taken out by the government of India. But still they found that the states are not following the procedure indicated in the drought manual. So a brainstorming was held, and so the stakeholders, that is the states, and which are normally the chief secretaries, principal secretaries, very senior policymakers, they indicated a lot of hitches with respect to the use of that strategy. So those hitches were removed. Protocol was revised in 2018. Another drought manual was brought out. But this time the government said, no, enough is enough. You have to follow this drought monitoring procedure. If you follow and you give us your memorandum, declarations, then we give you funding based upon the verification. If you don't follow this procedure, we don't give you. So since 2018, which is not very far, which is a very early affair, a recent affair, that this procedure started taking place. Now, what is there in that protocol, I will quickly like to mention. The 2018 Drought Manual Protocol states that each state has to, first of all, monitor the precipitation-based indices. There are two of them. I'll not go elaborately on them. So these precipitation-based indices, they set the trigger that whether the drought is there or not, yes or no. And once the yes is there, that these triggers state that yes, the drought is there, then they start monitoring the impact of that drought based upon the crop area unsown, the vegetation condition, the soil moisture condition, or the hydrologic conditions, depending upon what level of data is available with the states. There might be certain states where soil moisture would be monitored, which is a very hard thing to be spatio-temporally being monitored. So those states, they make use of that soil moisture condition index also to assess the impact. Otherwise, the others will stop just at the crop area unsown and the vegetation condition and things like that. So the basic, if you look at this protocol, it makes use of both the remote sensing as well as the ground station-based data for setting the triggers and for assessing the impact of the drought, for declaring the drought and its magnitude and extent. Now, because it makes use of both the ground station-based data and the remote sensing-based data, and the thresholds of each of these indices, which are generated through the use of this data, are set by means of stakeholder participation. So for the whole approach has a lot of subjectivity to it. And therefore, it adds to the very limited practical application of this protocol across the states with varying data gauging capabilities and as well as the data gauging interests. So therefore, we decided that why not to develop an India Drought Monitor under our Memorandum of Understanding with the University of Nebraska, Lincoln, and under the able leadership of the NDMC, which is the Masters in Drought Monitoring, and develop a technology which is more objective, which makes use of the satellite-based data products with the limited subjectivity added to them through stakeholder participation, because each time the stakeholders are invited to set I myself been in many of those meetings and I've seen them, dictating the values in order to tweak a worse condition of the drought, not the realistic condition of the drought, just to make the state look, drought hit. So we wanted to remove all these things and we came up with this protocol. I'll not be very elaborate on it. Basically, it makes use of the meteorologic indicators, the biophysical indicators, and the hydrologic indicators, all of which are generated through satellite-based data products, and to generate a final product called Composite Drought Monitoring Index. And what we did is basically, right now we are only making use of the Standardized Precipitation Index, the NDVI, and the Evaporative Stress Index, these three of them, each representing the meteorologic, agricultural, and the biophysical and the hydrologic drought conditions. And then generating the CDI product. In order to generate the CDI product, we try to investigate the use the satellite products at varying geospatial resolutions, because we wanted to find out whether a 500-kilometer product or a 1-kilometer product or a 5-kilometer or a 500-meter product, what should be utilized for accurate drought monitoring as far as Indian subcontinent is concerned. And besides this, what should be the cumulative drought index duration, whether we need to generate a monthly product or a 15 days product or a weekly product, what would be good, or a 3 months product or a 2 months product. So we tried all this, we did a lot of R&D, and we found that this particular methodology which we had developed, number one, it can be applied at varying spatial resolutions. Whether I apply it at 500 meter or 5 kilometer or 1 kilometer, it gives the similar results. Only the coarseness or the fineness of the results will be different, but the pattern doesn't change much, and so it has the capability to give the near real-time drought monitoring. Second outcome of this investigation was we found that in comparison to the 3-month product, the 1-month product performs better. And we are quite hopeful that if in future we want to do a forewarning, then we can even generate 15 days product or say a weekly product. But that means adding to more satellite-based data product availability. So time doesn't permit me to go into all those intricacies of the research. So I'll just quickly show you the broader results. So we did that, and we applied, besides this, we integrated all these 3 indicators by giving we didn't want to give the weights are unknown, so we tried different methodologies. We gave equal weighting. We tried equal weighting method vis-a-vis the principal component analysis methodology, because ultimately we wanted a product which should be fully automated, so that whether I run it or somebody else runs it, the results should be same, and that was a basic need for that. So we found that as compared to the equal weightage, the principal component analysis methodology seems to be giving very good results. So that was a very good hope for us to go in the forward direction. So we applied the tool, as you had seen, across India, and then we went ahead to validate it on one of the 2 most drought-hit areas in the country. And these are the Karnataka and the Maharashtra. And as you can see in the map, these are located right in the southwestern part of the country. So these are some of the products we generated for the Maharashtra or the Marathwada region. And as you can clearly see, the comparison between the single versus the composite drought indices. If you look at this standardized precipitation index for the month of October, it appears as if there are no more drought-like conditions. But if you look at the agriculture biophysical indicator, NDVI, or the hydrologic indicator, ESI, and again, the CDI, the Composite Drought Monitoring, Composite Drought Index, they all show that the area has already been hit by some degree of drought. So the point which I want to mark here, that the single indicators are not able to really simulate the actual drought conditions on ground. So therefore, it is always better to have the composite drought indicators. And if you compare the single biophysical, single ESI, and vis-a-vis the CDI, again the pattern and the spatio-temporal distribution of the drought also varies. So we started comparing the CDI with the drought declarations by the government. So this processing we did for 16 long years across India from 2001 to 2016. And then we started doing validation on 2 of the most drought-prone areas to see whether this product is really able to capture the drought or not. And then next question was, what should be the benchmark against which we have to compare its capabilities? So we said, okay, let's pull out what were the declarations by the government of India, because at that point of time, we were not sure whether these declarations were fake or real. So we had to assume this as real. So we pulled out the drought declarations, and then we also applied the government of India's recent protocol of drought declaration as per the 2018 manual, which is shown in the yellow map below. And then we also compared it with the yield deviations, because those are also Government of India declarations. And if you look at all these 3-4 things and put them together, it very clearly you can see that as per the Government of India declaration, the drought was widespread. They declared it as a severe drought. But as per the CDI, if you see, it was like moderate to severe drought. Mostly moderate, with some pockets in which the severity was there. So we went ahead and compared it with the Government of India protocol for 2018, according to which it was a moderate drought all across the region. But if you compare it with the yield deviations, you find that the yield deviations are quite matching with the CDI observations. So not only this approach, through this approach we found that the Government of India declarations of the severe drought conditions was kind of a fake, because they wanted to bring more area into drought to get more quantum of funding from the center. But the current protocol is also not able to capture the drought conditions. Secondly, the second problem with the current protocol, it is following the lumped approach. So it doesn't precisely tell us that within the district or within the block, what is the spatial extent and severity of the drought. So it appears as if the whole block is under the severe condition or the whole block is under the moderate drought condition. But actually the same block is under 3 different categories. So by knowing, if a stakeholder knows that, what is the category of drought within the block also, then he can appropriately and proportionately distribute the center granted funding. So because instead of distributing 100 rupee into 1 rupee to all, then some people can get 50 rupees, some can get 20, some can get 10, depending upon their need, and thereby reducing the farming issues on ground. So we also tried to apply this tool on in one of the moderate drought years. And again, as you can see very precisely, if you compare CDI product with the crop yield deviations, they are quite matching, while the drought declaration by the government were not matching their own yield deviation data. And also the Government of India protocol recent 2018 was not able to capture the drought very well. Again, we wanted to see whether this same approach is able to capture the normalcy of the normal condition also, or not, or it is only able to capture the drought conditions. So we see that it was, CDI could very realistically capture the normal conditions also. And this was on the Marathwada, and then next state on which we applied was Karnataka. It is also one of the most drought-hit areas in the region. And the story is the same, and you can yourself see that the Government of India declaration was severe drought for 2002 all across the state. But if you look at the CDI variations and compare them against the crop yield deviations, they're quite, in sync with the crop yield deviations. And the Government of India protocol, definitely 2018 protocol, also was not able to correctly capture the drought and its spatial extent. Again, same for the normal year 2010, CDI could perform very well. And again for 2015, which was kind of a moderate drought for the state, and this also could be very nicely captured. And I would like to mention here that the CDI product, which I'm showing you here, is a 5-kilometer product. It's a coarse resolution product. We deliberately started with a coarser resolution product to see, because if a coarser product is able to capture, then definitely the finer product will be able to give the finer details. So we hope, now recently we also tried to compare this with another drought monitoring methodology, which is called South Asian Drought Monitoring System. The results are still awaited, and also we are trying to see what is that spatial resolution at which we should be giving the product to the state, whether it has to be 5 kilometer or 1 kilometer or 500 meter. So our SOFAR study, I haven't put the results here, it shows that 5 kilometer to 1 kilometer product is good enough to reflect the near real-time drought conditions as far as India is concerned. So with this, thank you very much for your patient hearing.
Thank you very much, Dr. Kaur. So our fifth presenter and last presenter this morning is Dr. Jesse Bell, the Claire M. Hubbard Professor of Health and Environment at the University of Nebraska Medical Center in Omaha.
All right, so I'm going to speak a little bit broadly and then kind of bring it back into some of the work that we've been doing. My goal up here is to talk about the impacts of drought on human health and how potentially public health can help with some of the intervention with some of that. I always start off with this. Floods kill people, but droughts destroy civilizations. And one of the things I really want to try to emphasize here is that not only do droughts destroy civilizations, but they do also kill people and, as they move forward as well. So we know that droughts likely have killed more people internationally than any other climate or weather-related disaster. And that's internationally, but here in the United States, and that's primarily due to famine and malnutrition, but here in the United States, we really don't think of drought as a human health threat in any way. So here's NOAA information gathered for different different weather-related disasters across the United States. And it's one of the things that you'll notice is that drought's not one of those up there that's got a death toll associated with it. But we know that drought does have severe economic impacts on our communities and our states as well. During that same time span, drought and heat waves combined through this NOAA analysis found that droughts cost about $78 billion of economic loss from 2004 to 2013. And we know that over the last roughly 30, 40 years, that droughts in the United States we've had $25 billion disaster events that are associated with droughts here in the United States. And those $25 billion disaster events have totaled $241 billion of economic loss here in the U.S. And obviously these have huge impacts across the United States. But one of the things that you'll notice here, and I know I just said that droughts aren't necessarily associated with human health outcomes, but during those $25 billion disaster events, there was about 3,000 people that were associated deaths associated with those droughts. And those 3,000 deaths are actually tied to heat waves. And so when a drought happens, typically what can potentially happen is you see an exacerbation of a heat wave. You see a more intense heat wave that happens at the exact same time. And so those 3,000 deaths are associated with the heat waves that were intensified during those drought events. But obviously that's just one component, that's just one sliver. But it's also very difficult to try to understand all the different health impacts that are associated with droughts. Droughts are a very slow evolving disaster, unlike many of the other disasters I put up there before. Hurricanes, things like that, they hit and you can see the impacts immediately. But drought kind of just rolls in slowly, and the impacts can be long lasting and have intermediate potential pathways to get to the human health outcome. And so surveillance data, health surveillance data, it really isn't designed to try to understand the relationship between drought and human health outcomes, because there's not an ICD code associated with a hospital visit that says drought. But there's all sorts of other things that are potentially coming on or happening during those drought events. And so one of the things that we're trying to do is try and understand some of those relationships and see why more people are going to or if more people are going to the hospital or dying associated with some of these drought events, and what that actually means in terms of cost of life. And here I'm just going to try to emphasize some of those potential impacts between drought and human health outcomes, and some of the pathways that we already understand and we already can kind of identify. So first off, the middle circle, that was the different drivers of potential drought. Then that second circle is changes in their environment or changes in our ecosystems around us that could potentially lead to human health outcomes. And then last, we have the human health outcomes that are associated with those changes in the ecosystems. And by the changes in ecosystems that we see with drought, so one, like I mentioned before, an increase in the intensity and frequency of heat waves, reduction of water quality and water availability, changes in vector disease habitat, food security issues, and then also dust storms and wildfires that are associated with it as well. And all of those things have potential human health outcomes that are attached to them. And so this is just another way of looking at that relationship. So on the far, where I'm looking at the far left side, you have the drought outcomes, or the droughts themselves. Then you have the pathway in between that gets you from the drought event to the human health outcome. And so that's the general flow of it. So that's looking at those circles that we just previously seen. But one of the things I want you to understand or point out here is the environmental and institutional context, and then also the social and behavioral context. These are the things that potentially either increase the number of deaths or hospitalizations associated with drought, or decrease the number of hospitalizations or deaths associated with drought. And so by environmental or institutional context, we're talking about what is the actual water supply for the communities, what do those communities look like, what kind of agricultural management systems are in place, what kind of utilities are in place in general. And then by social and behavioral context, that's what we're talking about. What do the people in those communities look like? So what's the occupation? Where are they rural versus urban? What's the race, literacy, ethnicity? What is the access to health care? And is there preparedness plans in place to make people understand the relationships between drought and human health? And so that's kind of getting back to the vulnerability of the populations. And so again, that's some of the work that we're doing, is trying to identify some of the vulnerabilities within communities that are associated with drought. And by vulnerability, we calculate that using exposure, sensitivity, and adaptive capacity. To understand those three components, that gets at the vulnerability of the community, and then that gets at the number of people that could potentially be impacted the next time a drought event occurs. And so talking about some of that complexity, where we have multiple intermediate steps, we have potential lags between when the drought event occurs and when we see potential human health outcomes. I think mental health is one of the best ways of describing some of that complexity in itself. We know that when drought events do occur, there's potential financial strain that's put on communities, either through agricultural systems, water systems, whatever it may be. And that can have a ripple down effect that could cause mental health and behavioral health issues within that community as well. And so here's some anecdotal evidence associated with that. There's a Kansas farmer that was talking about how there's an alarming they were talking about how there's alarming suicide rates in agricultural workers across the United States. They have one of the highest suicide rates of all occupations in the U.S. And this farmer said that nothing gets a farmer down more than drought. And then over here we have an example in Australia where they showed that during major drought events in Australia, they saw an increase in suicides in rural communities and agricultural communities across the country. And there's a number of other examples across the United States and across international work as well that have shown droughts and the associated impacts on mental health. Actually, some of the earliest work that I found was here in Nebraska back in the 1980s with a major drought that occurred. And so this is just to illustrate the complexity of that pathway from a drought event to mental health outcomes, anxiety, depression, and suicide. And this is work that I did with my colleagues over at CDC and Emory a couple years ago. And so on the far left side of the screen, we have the drought event. And then what you see is the pathways getting over to the potential mental health outcomes of suicide, anxiety, and depression over on the far right side. And that just illustrates the complexity of some of these issues and how when you're trying to do public health interventions, you need to understand some of this complexity so that you can come in and do mitigation and come in and be able to provide assistance in with some of these linkages that are potentially causing human health outcomes. And so before my previous role, or my role now at the UNMC, I was working in a joint role between the Centers for Disease Control and Prevention and NOAA, the National Oceanic and Atmospheric Administration. And so I worked as a kind of a liaison between those two institutions. And one of the things that I was focused in on there was not only, I was focused primarily on climate impacts, but then a lot of my work was actually focused on the drought impacts themselves. And so we had internal funding to try and understand what are some of these potential drought impacts on health. And not only that, try to build up our education and information to public health officials so that they could help understand the potential impacts as well. And so one of the things that we did was improve the communication efforts so that public health officials can understand the potential impacts of drought on health by improving some of the communication that we had on our website, providing fact sheets to public health officials so that they could understand the potential impacts on from drought to human health. And then the guidance document, this one was actually made before I was at CDC, but we did a follow-up document where we did the preparing for the health effects of drought. And so this is a resource guide to public health officials so that they can understand the potential health impacts and how to actually do mitigation at the state and local level. And the other thing that we did was we provided drought data on the CDC environmental tracking platform. And so this provided data in an easy, accessible fashion to public health officials so that they could understand the relationships of drought on human health. And they could access this data and access this information and use it to do their own studies at their regional level. And so with that, there's still a lot of work to be done on trying to understand the impacts of drought on health. That's some of the work that I'm doing with my postdoc and some of my research and my PhD students, is trying to mine through the data and try to figure out what are some of those relationships. But also we're trying to do this and address this at a national level as well. And so I'm helping work and lead some of the efforts on drought and health with my CDC, NOAA, and NDMC colleagues. We formed a national working group on drought and public health. We are also having a summit this summer to understand the potential impacts of drought on health and try to understand what are the gaps and needs and what are some of the opportunities moving forward so we can have better information provided down to the state and local sector. And so with that, thank you very much for your time. I greatly appreciate it.
Excellent. Thank you, Dr. Bell. Yeah, if I could ask the speakers to come up to the front, and we have about 20 minutes or so for questions for the panelists. What I'd like to do is start first with kind of a basic question, and then we'll open it up to the audience. But I'd like each of the panelists to think quickly about what's one big obstacle that you see that stands in the way to your now what next step. So, Mark, maybe you want to start with that, and we'll. Yeah.
So literally, another graphic that put us on the map that Dr. Rohite worked on when he first started the center was called the hydroillogical cycle and empathy. You don't react to any hazard typically until you're in it, right? And the worst time to manage a disaster is when you're in it. So that's why we're preaching the proactive risk management approach versus a reactive response, crisis mode response. That's my 2 cents.
Well, in case of Brazil, I would say that it's the challenge to work in a collaborative way, share information. This has been a challenge in the monitor process.
Working across political boundaries. All the ministries we work in, they have their policies, they have what they're expected to deliver onto a government, and they're often they're 180 degrees different, and then when a drought comes along, that's very challenging.
I think if I look at the Indian ecosystem, it's the data availability. I think that's the major challenge, and the reality of that data, whatever is available, if data is available, how real it is. So that I think is the major challenge.
And for me, I would say that it's awareness. In the public health sector, we really don't think of drought as a human health threat, especially here in the United States. And so it's trying to bridge that gap and have the people that are working out on the ground understand the potential health impacts. Because I think a lot of them don't even see or know that they're in drought when it's occurring around them. So I think that's probably the biggest thing.
I just wanted to say that Mike didn't tell us what the questions would be, so I'm just really proud of this panel to give 5 different answers on the fly like that. That's awesome.
So I think some of you emphasized it more than others, but all of you have indicated how important data is to making good decisions and preventing the worst outcomes when it comes to drought. If you could, this is for anybody or all of you, but is there any sort of innovative ideas that involve people submitting data to a common platform to be used in an integrated system for prediction? That any ideas that you've had or developments that you've seen that we should look out for and think about contributing to?
Let me jump in first on that quickly. I didn't cover it in my talk. Again, we only had 10 minutes. So we established what we call a drought impact reporter and a database back in 2005. We've collected maybe around 80,000 reports to date. But how that's evolved, I will say that was primarily media driven in the past. We were collecting based on skimming or electronic news media through a service and through like typical Google searches. But the assistant director of the Drought Mitigation Center, Kelly Smith, she's working more recently, and we are as a center, on like Survey 123 and other methods of collecting information in real time, sort of citizen science of condition monitoring. Just tell us what's happening. We'll kind of figure out if that's drought or not. And doing like hashtag drought 17 in the Dakotas was a huge surge of people commiserating, if you will, and getting their message out and their voice out. And that's sort of a nice indirect validation of our drought monitor as well. So we have some current, and she's doing research now in her dissertation that looks at tweets and Twitter feeds and the survey activities and mobile phone collecting photos sort of in a longitudinal way to look at conditions over time. So that's my example.
One of the areas that we've been looking at is data that we can support insurance companies. Because at the moment, the great liability of drought comes along, it's expected that the government will pay. And so what we've been doing is we've been working with some insurance companies looking at how can we take some of this data, but make it in a form that insurance companies can use to then make payouts. For example, in Lebanon, when a drought comes along, it's called the National Crisis Center. And this group of people, they go out and assess what has been the impact, how many goats have you lost, how much has been your yield. But the people doing that are from the army. Now, their ability to make this assessment is there's not the training there. So it's like how can we get different data to support crisis funds or insurance companies, whoever it is, to make it a much more, because what's important is not just the impact of the drought on this season. If we can get that funding out quickly, the farmers can then buy the seeds and the fertilizers for the next season, so the drought doesn't impact the next time as well, so we can limit those impacts.
Well, it's a very good question. I mean, I would say it's like a dream which one would like to have. How can we innovate in having better data and consolidated data under one umbrella? So this thought has been going on even in the Indian ministries and in the mind of the Indian government. But before saying anything, because it's always very easy to say, but very difficult to operate it on ground. If you look at the Indian canvas, it's not like one country. It's like a subcontinent. Each state is like one country. So, and then within the country, there is so much of geospatial diversity. And there are diversity in terms of what are all operations are going on, but also diversity amongst the actors who are taking care of those operations on ground. But having said all that, I would say that in spite of all that diversity and the vastness of the country, we have an exceptionally good, structure, organizational structure, which actually exists even as of now. The only problem, as Mark said, it's the people. Like with what level of integrity and truthness you really go down and dig that data and put it in the repository. If you look at the data, like I did a study for National Capital Region, which is a region, not a state. It comprises of 3-4 states. And I could clearly see that if I look at the data before 1980s, it was beautiful data. And you can make out that it is correct, real, because it was in sync with various other phenomena. So I could cross-check it against this, that, and everything. Like if a person is sick, then you can check his BP, and then also check other health parameters, and then you are very sure whether one is healthy or not. So similar exercise was done on this data. But after 1980, I could find that there were many glitches in that data. So it only goes to state that the ethics and the integrity of the people who are there responsible for monitoring that data is not there, but the infrastructure, structure, organization, everything is there. And it's a beautiful organization. If somebody takes good care of that, we can have excellent data generated.
And I just want to quickly jump in on that as well. Anytime you're doing anything that's public health or health related, access to data is a huge issue. Trying to find large data sets that are health related is almost next to impossible. And if they are available, there's a lot of suppression issues with them, especially here in the United States. And so one of the things that we're doing is trying to address that by doing some data mining techniques to try to pull out some of those relationships, because it's already so complex just trying to deal with the complexity of drought on human health. And then you try to add in some of the data limitation stuff that we have here in the United States when we're trying to understand some of these relationships. But then one of the things that we've been looking at is how to get a hold of maybe other data sets that can show you some of those relationships as well. So things like WIC or those types of data sets that maybe can give you some understanding of community stress in some capacity. And also when we were at CDC, we also provided surveys out to the state and local public health officials. And I thought that was a wonderful way, because then you hear directly from the people on what they're facing, and you're not necessarily trying to mine that out of the data itself. Now that doesn't really get to the point of like, how do you forecast that moving forward, but we'll try to tackle that at some point as well.
I think one of the great results of the monitor process was the integration of all databases that we have available in the country. So we have access to the federal networks and the state networks as well. And along with that, we were trying to look at the network with the end farmers as well. So get the data from them as well. It's not easy task. We're trying to do a pilot in CRI state that we have some experience with volunteer work on rainfall monitoring. We have like 550 rainfall gauge stations. Basically, volunteers provide this information to us, and this complements the automatic weather stations network that we have. So we have to be innovative. Also, we are looking some text mining, if you will, in those media, but there's a lot of gray documents there. We have to really look careful if it's really a drought or some, I don't know, misinformed reporter that's trying to raise attention to that particular region. So we have a lot of work to do in this area as well.
I would just like to say I think human nature really is a major, major issue when we talk about water at almost any level. And of course, the whole question of climate change is a huge human nature discussion. And it seems to me that the data that you're collecting and the tools that you're establishing could be very useful for helping us understand what's happened in the past and maybe even help make projections into the future. And it seems to me that the issue of making projections into the future is very, very important. It's also very difficult, as one of the speakers alluded to. So, looking at all the evidence for a changing climate that we've seen in recent years, the fires, tremendous fires last year, and floods that we've heard about here today, insect infestations in eastern United States that are developing right now. How do we make projections into the future, or is that even possible?
So under phase one of our this USAID-funded drought project at ICWA, that we have been doing that. We've downscaled the climate change data, and we're now looking at changes in the index is called consecutive dry days. So we're trying to see how that's going to change. We know that the whole Mediterranean basin, the area that we're working in, is going to be one of those most affected. It's a hotspot for climate change. But what we're also looking at, it isn't just the climate data we want to look at. So what we're looking at is we are modelling river basins to look at how will groundwater, how will surface water be impacted. We're taking 8 model outputs. We're also running them through crop models, because what we are interested in is the impact on water and food security. And what we're trying to do as we're developing these reactive plans, proactive plans, trying to build in the resilience that will not only get us through the droughts today, but also in 10 or 15 years' time.
The health impacts are definitely harder to project forward and trying to figure out what some of those relationships are. But I definitely think that it's something that we need to focus more on. And some of my colleagues at EPA have been doing a number of studies where they've been trying to project some of these health impacts. They haven't necessarily looked at drought yet, and that's actually one of the things that we've been talking about is how we potentially project some of these health impacts moving forward and looking at drought. But they have done things like wildfire and dust, which are obviously associated with drought in some capacity. And so there's already opportunities to make some of this work available, and there's already some movement in this area. So I'm kind of excited to see where it could potentially go.
Actually, we've been doing some studies. The previous technical assistant of the World Bank in my region was on climate change impacts on the water and agriculture sector. And we try to make projections, but really not on drought, because we don't do prediction drought with those models. We try to depict some characteristics of droughts that these models can provide. And for north of our region, most of the area would be increasing, for example, the number of dry days, consecutive dry days. That's for sure will impact the rain-fed agriculture. Yeah.
I'll just add one thought to what you just said there, is that those consecutive dry days is, to me, perhaps no hazard is more analogous to climate change than drought. It's the frog in the pot, right? It heats up slowly. That frog doesn't figure out till it's too late to jump out. But it gives impetus to the pillar one, where all the more reason why we should be heeding the day-to-day, diligent, week-to-week, month-to-month monitoring. And even then we stick our heads in the sand and don't react until it's too late. So these baselines are changing, the frost-free period, the days between droughts. The more intense events on a crusted landscape causes more rapid flooding. Some of your worst floods are during droughts because of that reason. And then the latest national climate assessments showing these statistics and trends are there. The guy right next to you, Dr. Rowe, has worked a lot in this area with the Nebraska climate change report that came out a few years ago. Others in the room, certainly more experts than I am, even though he taught me a lot of applied climate going through there. That dates me, but I think it really dates you, Clint. So anyway, I think these are all things, though, the signs are there and people choose to ignore them often, that we just got to keep fighting the good fight. And you've seen the states that are planning for drought or for climate or other things are growing. FEMA's now requiring in the multi-hazard plans, you're seeing drought integrated into other plans. So we advocate drought as a piece of any planning activity, not just a standalone drought plan, but states have fewer resources, people wearing a lot of hats. Let's make it more, let's provide resources and guides to help them integrate it into things already on the books, whether it's a water plan, a master plan, or a drought plan.
My question is a little bit ambiguous, but I would like to see if you can clarify some of it. And it's about the social aspect of drought. And do you see the social intervention changing from a relatively passive way to a more active way? So far, what the examples that you have shown are led by private, public sector, centralized entities, and the society is seen as the affected rather than the participant or the co-participant in solving the problem or help to tackle it. So do you see intervention of society more active in the future? If it's not the case, how we can create a more social awareness or society more aware about these issues?
Give you a one-word answer, yes, and right here. Even when we were in Mali, and Dr. Wardlow and Dr. Hayes will remember a workshop we did there with the WMO, how they might not have much, but they've got a phone and it's a voice. And I remember their Met service, we couldn't hardly get data from them, but farmers and people out on the field in Mali, you wouldn't think that at all. They've made the technology leap. They're providing information through those phones into the agencies at the state level or the central level, providing pictures of, hey, we're hurting here on the ground. Hear my voice. I mentioned hashtag 2017 drought in the Dakotas for the livestock producers just a couple years ago. So I'm seeing a much more active voice in social media and people being connected to their devices.
What about private companies and their involvement in some of these things, or Farm Bureau, some of these NGOs? Are you seeing more involvement?
Good point. We monitor, at least at the Drought Center, a couple of my staff actually, Mike, as you recall, they're monitoring that blog atmosphere, those voices coming in about impacts, what they're seeing, how it's affecting crops, livestock, through the Farm Bureau, through other agribusiness entities. I think the bottom line for me would be yes. I don't know about others. I don't know.
We're working with a number of different organizations, farmers' unions. It's a very good conduit to get, because different sectors need different inputs. One of the things we're also working with under phase 2, we will be doing workshops with journalists. It's very important to show what is a drought, what does it mean to be a drought, how can, it's all very well screaming when the drought's there, when the water's turned off, but we want a much more better engagement with that. We're also talking to reinsurance companies and to banks. For example, farmers are not able to make their payments during times of drought. What can we do in understanding that? How can that be felt? So many, many different sectors we need to talk to help understand drought and ensure that, as we know, droughts are going to increase in extent and longevity, that communication is good.
Well, as far as our side story is concerned, we have just developed the protocol, validated it, and we have showcased it to the policymakers, right? And from what has happened in the last workshop in January, wherein we had called all the policymakers, all what I can say is that they were kind of provoked in a very right direction, and they have started taking drought more seriously, and they are responding to us better than before, because we have given them a hope, a confidence in a technology which they were not having in the previous technologies because of the subjectivity, as I just said. So I think gradually the things will build up. We are building the blocks one by one. So we are still far away from what Mark said.
And I just wanted to quickly add to that. That's one of the sectors we want to try to branch out to with the Drought and Health Summit this summer, and make sure that they're involved in some capacity. And that's the hospital associations. Mm-hmm. Hospital in the United States is a private business. Mm-hmm. So we want to bridge that gap and bring them aboard as well, so that they can start to understand some of these health impacts as well.
Great. Well, we're right at noon, so I think we'll end this session. I want to thank the PowerPoint and sound person in the back, the cameraman, and then Nicey for taking the notes and keeping time. Thank you for them. And I want to thank our panelists for the very interesting discussions that we've had this morning. So thank you very much.